Action.
Hi, my name is Jennifer. I'm going to be doing an assessment on my daughter today. Her name is Lindsay, but she's going to be playing a patient named Susan who came into the clinic today. Hello.
Hi.
For cough for the last 4 days and some chest pain when she has the cough. Also, she said she reports she's been having a fever. So, if you don't mind, I'm going to be possibly touching but I'll be discreet, and then I'll be using the stethoscope if you just get asking permission. I'm going to clean my hands first. And then what I like to do is do a set of vital signs just to get a baseline from you. So I'll put a blood pressure cuff on. I'll put her arm out. I'll wrap where the arterial goes right there. Have that going. I'll be taking her pulse. I'll also be looking at her respirations and counting for the minute, how long, along with the pulse. Also with the cough and the shortness of breath, I want to check her oxygen saturation, so I'll be putting that on her finger and measuring that. I'll also be taking her temperature, which I could do from a temporal scan, where she would go across and behind her ear. Or I could do oral under her tongue for a temperature. Also, I will be asking about pain. So you said about when you have your cough, you get that chest pain. She reported that it was a pain scale 8 out of 10, mainly when she takes a deep breath and when she coughs. Okay, and then the next, due to the symptoms that she has explained to me, I'm going to go over some of the systems. One of the systems would be the HEENT. The first one is of the head. So I'm going to examine her head. I'm going to look for symmetry down the line. I'm going to feel her scalp and see if there's any, bumps or nodules or anything that's tender. Anything tender? No? Okay. And then I'm going to check on your sinuses. I'm going to do the frontal sinuses. Any tenderness when I touch there? No. And the maxillary, sinuses, I'm going to go just like that. And any tenderness? No. Okay. And then I'm going to check your lymph nodes. So there is a lymph node in the back, the occipital. And I'm just going to feel for any nodules or any bumps. And then I'm going to check on the post-auricular behind the ear. Nothing. And the pre-auricular in front of the ear. And nothing. And then I'm tonsillar back here. And the submandibular under here. And then the submental is right under here. I'm going to check the anterior cervical, which is going to be in the front of the main muscle that comes down. And then I'm going to go in front, and then the posterior cervical is going to be behind, and right where her clavicle is, right above it, I'm going to check on the supraclavicle, and that looks good. All right, and then the next one I'm going to be doing is her eyes. Okay. I'm going to check out the skin. I'm going to check and see if there's any, if she has any irritation, break in the skin or swelling. And I don't see any of that in her eyebrows and eyelids. And then what I'm going to do is check on her corneal reflex. And then what I would do is get a light cotton ball. And what I'll do is I put it right by her eye, and I'm going to have you look straight ahead, and then I'll touch her eye with the cotton wisp, the cornea, and then a reaction would be for her to blink with both eyes. And then what I'm going to do is I'm going to look at her pupils, as if you could look straight ahead, and then I would get a pen light, and I would look, and I would check and see her pupils, if they're round, equal, reactive to light. I would shine the light over at this eye, look for the pupil to constrict and see that pupil constrict as well. And again, I would put it over here and I would again see that her left pupil constrict and her right would constrict along with the left, even though I wasn't shining it in the opposite eye. And then what else I would do is I would do her extraocular movements of her eye. So for this little moment, I'm going to have you look at me. So if I could come this way. Okay. And I'm going to have you follow my finger. Okay. So we're going to go all the way to the side. We're going to go up. So I'm sorry. Yes. Don't move your head and just have your eyes follow my finger. So up here, we're going to go down here, back up. We'll go to the middle. We're going to go all the way to the side, go up, back down, and to the middle. Perfect. And then I would do the confrontation test, which is the peripheral. What I'm going to do is I'm going to wiggle my fingers and let me know when you feel it or see it come into view. Okay. I'm going to go from back here, just looking at me. See it? Yeah. Okay. And then I'm going to go up above and down below and tell me when you see it. Okay. And then we're going to do that one more time. Okay, perfect. That's great. All right. And now we're going to move on to her ears. I'll keep you just like this, Lindsay, or Susan. So I'm going to check out her ear, going to check out the external, see if there's any, how the skin is intact, if there's any, you know, nodules, look and see if there's any drainage coming from the ear. And then when I go to look, I'm going to use an otoscope. And when I look inside with the largest cap on it, I'm going to look inside. For an adult, you're going to pull up and back, and for a child, you'll pull down and back to look inside the canal. I'm going to look for the tympanic membrane, look for any swelling in there. Hopefully, if possible, there might be a perforation if there's if she's been having pain, and also ask if you've been having any pain in your ears. I would also check, sorry, can I have you turn that way? Because I'm going to do something from behind you. Thank you. I'm going to do a whisper check. So I'm going to close this ear and tell me what I have said, okay?
Apple. Blueberry.
Okay, and she did the whisper test. Okay, and then I'm going to do the Weber test. Sorry, I'll have you come back. You can face forward. I'm going to do a Weber test, which I would have a tuning fork. And what I would do is bang it on my hand. And this is the Weber test, where you would put it right on the scalp in the middle of the bone, right here in the middle. And then what I'm going to ask her is if she hears it in one ear, both ears, the left ear, right ear, or both ears. And it should conduct to both through the bone. Then I would do the Rhine test, which I would hit it again, and I would put it right here, bone back here. And the mastoid bone right behind her ear, and just the bottom of it, the point. And then I would ask you to tell me when you stop hearing it. And then when you stop hearing it, I'm going to put it in front and do the air and have you listen. And what is normal is for the time when she stops hearing the bone, and then when she stops hearing the air should be double the bone. And then the next assessment I'm going to be doing is her nose. I'm going to have you, if you can look up for me, I'm going to look up in her nostril. I would be looking with an otoscope and check. I would use a different cap. And then I would look up and check in her mucous membranes in there, see if there's any tears, if there's anything unusual in there, inflammation. And then I would do a smell test, and then I could get like an alcohol wipe, and then I would put it in front of her nose and see if she can smell that. And then I'll move on to the next, and we'll be doing the throat and the mouth. So with the throat, I'm gonna check, look at her skin. You can look regular, thank you. I'm gonna look at her skin, look and see if anything's sticking out, any thyroid, any goiter, anything. And then what I'm gonna do, and see if it's intact, the integrity of the skin. And then what I'll do is, if you don't mind, I'm gonna feel right here, and we're gonna look for the trachea, check the thyroid, and see if, can you swallow? Well, you just did. Thank you. I felt that. That's great. And then what I'd like to do is look in your mouth. Thank you. I'm going to look for her teeth, the dentition. Can you push your tongue up to your mouth and see underneath your tongue? Thank you. It looks great. And then if you go stick your tongue out again, I would have my light and I'd look in the back, and I'm going to look for her uvula. And from what she has told me is that she has no tonsils. She had a tonsillectomy. And so I would look through the back of her throat, look at the way back at the pharynx. I would put on a glove and I would feel her hard palate on the top. I'd look at the soft palate and the sides and feel her cheeks. On the inside, I'd also check her gag reflex with a tongue depressor. Stick that in and you would go, as I was looking in the back. And then if I stuck it too far, you would have that gag reflex where she has tears kind of coming out. I want to look at the facial movement, see if it's symmetrical. Can you, well, smile. Very nice. And then can you frown? Can you do your eyebrows, squinch your eyebrows? There you go. It looks even. And then what I want to do is I want to feel the temporal mandibular TMJ. If you can open and close your mouth. Perfect. A couple times. Perfect. And then I'm going to check the masseters. Go again. The muscle here. Perfect. That looks great. Then I'm going to go next and check on the tongue. Again, can you stick your tongue out? Open your mouth. There you go. And then what I do is if it looks symmetrical, it looks good. It doesn't look like there's anything on, any exudate or nothing. If you close your mouth and then if you can push your tongue to your cheek to one side and then to the other, we'll see the strength. Yep, that looks great. Strengthen the tongue. And then I'm going to move on and check with her lungs. So with the lungs, I'm going to there's a couple of things I'm going to do. I'm going to first look and see if it looks like she's having any difficulty breathing, if everything looks symmetrical, the anterior diameter, the diameter of the thorax, the transverse diameter. Evaluate the shape and it looks normal, no barrel chest or anything like that. I'd also look at her spine. And I'm gonna, the vertebrae, and I'm gonna check, if you can lean forward for me, and I'm gonna check and see if it's straight or if there's any curvature like scoliosis, lordosis, and it looks great. And I'm gonna palpate it and feel if there's any pain when I do that. No. And then what I wanna do is check for fremitus. And so what I'm gonna do is I'm gonna put, I'll have you actually turn backwards now, sorry.
Face it.
Yeah, face the, yeah, thank you. Sorry, lack of room here. So what I'm going to do is I'm put my hands on her back, and then I'm going to ask you to say 99.
99.
Say it again.
99.
Okay, that's checking for the fremitus. And then what I want to do is percuss her lung tones. What I'm going to do is I'll put my middle finger here, and then I'm going to use this middle finger to tap it. And see how it gets duller down here. When the lungs are full with fluid or inflammation from possibly being an infection, we would hear the dullness up like a little bit higher where the maybe the lower lobe is, and where maybe there could be inflammation in there, and we would do it on both sides. Okay, and so yes, there is dullness down here, and we feel the resonant up here, or hear the resonant up here. Then I would auscultate it, and what I'm going to try to listen for is if she has any wheezing or crackling or rhonchi. She had expressed to me that there was wheezing when she on expiration, and you could actually just hear it without even listening to it yet. But I would listen with the diaphragm. Okay, so Lindsay, I'm going to listen to your lungs now. If I can have you actually cross your arms and put them up, because I'm going to be listening down in your middle lobe as well. So I'm going to start here. If you could take a deep breath for me. Perfect, and go again. Perfect, and I'm going down. Go again. Nice, and again. Perfect, and go again. And again. Nice. I want to go over here, go again. And again. Perfect, thank you, Lindsay. And what I'm listening for is I'm gonna listen. I know that I was hearing the expiratory wheeze, and then when I went down to the lower lobes, I was actually hearing crackling in there, which tells me that there's it makes me think that there's going to be like a fluid or inflammation down in there. So, and then for the anterior, oh, sorry. And also when I'm listening, I don't want to make sure I actually don't go over the shirt. It's just going to go straight on the skin. So if I have you turn around, Lindsay, to the front, and I would oscillate again in the front, and I would go start here and here, just breathe regular, and then I go down. I want to make sure sometimes I might have to have her hold her breast tissue, but I'm being discreet today, so I go under and under here. Okay, and so that would be for the lungs, and then I'd move on to the next, which I would do the heart. So with the heart, we're going to check and palpate the anterior chest for thrills. So with this one, I would need you to lie down. If you can lie down here for me.
Like this?
Yeah. Perfect. Thank you, ma'am. And so what I will do is I'm going to check and see if I feel anything, any vibrations or anything, thrills. Just breathe normal. Perfect. Okay, and then what I want to do is oscillate her heart sounds. Again, it would be, I'd have to do it for a bare chest, but I'm just going to let you know the areas. I'm going to do her aortic, which is on her right. I will do the pulmonic, which is on her left, but in the second intercostal space. The third intercostal space will be the Erb's point. And then I would go down below to the tricuspid in the fifth, and then I would go again over here, which would be the apical pulse in the fifth. And that would actually as well be where I would find the point of maximal impulse. It would be the axillary and the fifth intercostal space. I'd probably have her arm go up like this, and then maybe even lean this way as I would feel for that pulse. I'd also turn the stethoscope over and use the bell, and I would go for those points as well, the aortic, pulmonic, Erb's point, the tricuspid, and the mitral, and I would check and see if I hear any bruits, like rough as it's going. And then I would finish with that. I have put on my paper the recommendations, plan of care. I want to do a sputum test to check and see what is the bacteria or if it's a virus. And ask her to use, hot steamy shower, humidifier, help to get it the phlegm up. I would ask her not to take it for anything for her cough, because we want the cough to be productive and to come out, anything that's in her chest. For fever, she can use the NSAIDs, ibuprofen, Motrin, or acetaminophen, and pretty much rest. Needs lots of rest. Try to be not around people with smoke. And then if it ends up being a bacterial, I'd also want a chest x-ray to visualize and see if there's anything in the bottom of her lower lobes that I could potentially hear. And if I needed to, once I get that sputum back, if it's a bacterial, then I would prescribe an antibiotic. Thank you very much. Bye.